presentation is Clean Pipes and Functional Wiring, Modern Approaches to Preventing Atherosclerosis and Arrhythmia. It's a complex title, but I'm the clean pipe guy, and my partner, Dr. Pubby, is the wiring guy. And so I'm going to talk about atherosclerosis, or buildup of plaque in the vessel wall, and how that disease process can jump up and bite you at age 60 or greater, but it probably starts in childhood. And then Dr. Pubby's going to talk about arrhythmia and arrhythmia management to reduce the risk of complications with abnormal heart rhythms. So this is me, and these are my two new puppies. And I'm going to talk about how this disease process begins in childhood. Clearly we know about heart attacks, but the substrate for heart attack begins when you're young. The arterial wall plaque really is the problem. We're going to talk about prevention efficacy, recommendations regarding risk factors, and the role of the cardiovascular specialist in treatment and prevention. So cardiovascular disease represents 30% of all deaths worldwide, about 15 million deaths per year. It's the leading cause of death and disability worldwide. The cardiovascular disease burden is increasing in developing countries, and risk factors are increasing worldwide with things like the exportation of tobacco. The economic burden is overwhelming. As you can see here, 118 billion in US dollars in 2000, 19 billion in the Canadian population. So these numbers are staggering regarding the cost of the disease to the worldwide population. Cardiovascular disease, though, really, it's the plaque builds up from head to toe. So we see it with coronary artery disease, CAD, but we also see it with peripheral vascular disease 33% of the time, and coronary disease with cerebrovascular disease, or stroke, 32% of the time. So this should tell you, we don't just develop plaque that flakes off and closes the artery in the heart down. It can flake off and close the leg artery down or cause stroke from the neck up. There's certainly prevention facts. We're going to talk about the defined risk factors in adults that are associated with accelerated atherosclerosis, but atherosclerosis begins in childhood, and the extent of atherosclerosis in children really correlate with some of the same risk factors. Here's a clean pipe. Here's an early collection of foam cells on the wall of an artery. This is called a fatty streak. And then as this progresses over time and inflammatory cells that circulate in and out of the vessel come into play, we develop a lipid core, which is the really development of cholesterol in the wall of the vessel. But when this erodes and flakes off, this fibrous cap becomes unstable, is when the cap flakes off and exposes an area in the vessel wall that avidly forms clots. This is the mechanism of heart attack. If this plaque rupture causes thrombus formation in your coronary artery, you can occlude the whole artery and people come in with a heart attack. But if this is in your neck and it flakes off and goes north, it causes a stroke. If this is in your aorta and flakes off, it can go down your leg and close up an artery and cause a cold white foot. Or if it's in the middle of the leg and closes it off completely, you have pain when you walk. So clean pipes are what we want to maintain. This early plaque develops in childhood and matures over time relative to the risk factors for this process. For example, risk factors are additive. If you have diabetes, high blood pressure, and you're a smoker, you get this quicker than if you're just a hypertensive patient alone, for example. And this is the wall of the vessel, and what you see here is when the plaque ruptures and exposes this clot formation is when we get really flow obstruction. And if further down the screen, if it's your heart, it's a heart attack, and if it's your brain, it's a stroke, and if it's your leg, it's a cold foot. So what we're talking about here is age-dependent plaque development, fatty streak, fibrous plaque, and then occlusion, but then again, the different organs that are involved, heart, brain, the foot, and aneurysms of the aorta. These two graphs look at age on this axis and the percent prevalence of this fibrous plaque either in the aorta or in the coronary artery. So what you can see is even among children aged 2 to 15, there is some plaque both in the coronaries and the aorta from pathology specimens, but as we increase in age, the presence of fibrous plaque increases in percentage. So this should tell you it starts here, but as we grow older, it increases over time. One of the more interesting pathology sets came out of the Vietnam experience. There's the Walter Reed Army Hospital in Washington, D.C., looked at the aortas of these young, healthy, strapping guys going through the Vietnam jungle. They're 18 to 22, and yet if they died of a gunshot wound, they looked at their heart and their aorta, they had some fatty streaks already developing. So we know that even in the healthiest young men in America, this disease process begins. So increasing physical activity is associated with increased life expectancy, so being active probably prevents this process. There's a direct association between obesity and insulin resistance in childhood. There's a direct association between obesity and lipid levels in childhood. And then tracking the body mass index. We look at weight, skin fold thickness, lipids, and blood pressure, so they all sort of go together. Clusters of multiple risk factors, though, persist strongly from childhood to adulthood. And these are the well-established risk factors for this buildup of plaque in the vessel wall called atherosclerosis: smoking, obesity, high blood pressure, physical inactivity, high blood fat levels or high cholesterol, diabetes, family history, some genetics we don't understand. But there's some emerging risk factors like certain ethnic groups, Southeast Asians, for example, and then anger in your life predisposes people as well, and I can show you some information on that. To this, we would add male gender and age. But this is the effect of these multiple risk factors on the probability of coronary disease taken from the famous Framingham study, which is Framingham, Massachusetts. They looked longitudinally at risk factors over time and event rates related to cardiovascular disease. And what you can see here is elevated blood pressure, cholesterol, elevated, low HDL, diabetes, cigarettes, and abnormal EKG suggesting changes on the heart from high blood pressure. The more of these risk factors you have, the 10-year probability of an event, a cardiovascular event, goes up to 40%. So what that says, you just have high blood pressure, you're at a 4% 10-year event rate. But if you have high blood pressure, high cholesterol, diabetes, and you smoke, your event rate is 40%. So this should just tell you about the additive nature of the risk factors for your own risk for a cardiovascular event. So smoking, complete cessation for those who smoke. So smoking's bad, you know about that, don't start, and if you are smoking, stop. We want to reduce the exposure from environmental tobacco and don't start at all. And then again, you are what you eat. So diet plays a role as well. 1, 2, 3, 4, with a pile of fries, right? I'm not sure you can get that here in Jacksonville, but so really, what's the best diet for us to prevent? Well, the Mediterranean diet has shaken out across the world because they live the longest and have the lowest incidence of heart disease in the Mediterranean part of the world. It's a diet, really high consumption of vegetables and olive oils, moderate consumptions of protein, and these are thought to confer some health benefits. Researchers found that people who eat a Mediterranean diet have a lower odds of having a heart attack. So really, whole foods wins, right? Maybe that's why who bought them? Amazon or something recently? Yeah. And I have a 13-year-old son, and he comes home all the time. And Dad, if don't buy it if it's wrapped in plastic or if you can't see it. I'm like, wow, that's a simple concept. So you buy stuff that you can recognize, right? If it's an apple, it's an apple. If it's a carrot, it's a carrot. But there's something about the Mediterranean lifestyle as well. They're happier people. They don't work all day long like us in the Western world. And we were just talking about this earlier, about working to live or living to enjoy your life. And there's something to be said about a quality of life that allows you to have joy and happiness, less confrontation, more love and attention from your family members and neighbors. Keep that in mind. So obesity, this is my favorite saying. I say it to all my patients: lean lives long. Appropriate body weight, you can go to the growth charts with the CDC and figure out what your appropriate body mass index for age is. Overall healthy eating patterns really help control weight. And then what you really want to do is balance energy in and energy out. It's a very simple equation. I don't know if any guys use weight and calorie counting apps, but there's apps all over the place. One of my favorites called MyFitnessPal, P-A-L. You can download it. You can enter the amount of calories you eat during the day. You can even search for things like the Zaxby's chicken salad. It's in there. They know how many calories is in that. And then they ask you to put the what you did for exercise in at the end of the day. And if the calorie count is green, you're going to lose some weight. But if it's red, you're going to gain some weight. These are some useful apps to go to sort of understand where you are. But this is one of my favorite pictures. It has a guy like with a remote control looking at the TV, and he's got his dog on the treadmill. So, so this is the classic, I walk my dog a mile a day. Sure you do. But this is job security for the cardiologist, right? This is what this is. Unfortunately, this is too much of America, and the diabetic obese problem we have is going to contribute to the cardiovascular disease mortality rate, the burden that society is going to have to encounter, not just me in the middle of the night taking care of heart attacks. This is age for weight charts for BMI over time, and these charts are available online. You can figure out where you are at age 14, what's my body mass index, and what's the risk that I'm going to be obese as I grow older. This is trends and prevalence of being overweight in the United States. In blue is age 6 to 11. So in the 60s, we didn't have many people that were overweight, age 6 to 11, but by the year 2000, 15% were people who were overweight in the 6 to 11 year range. 12 to 19, it correlates as well. So what you have here is really an increase in people being overweight starting in childhood in the United States. And if they were 19 at 1999, they're seeing me in the cardiology office now. BMI, body mass index, I'm going to skip this slide because it's complex, but it's basically as your body mass index go up, we want to be more aggressive about getting things down. Physical activity, so 60 minutes per day, every day for children is the recommendation, 35 to 40 minutes per day. Most days of the week is the recommendation for adults. We want to reduce and limit sedentary time. My son calls it screen sports. I call it, the computer. You certainly adding resistance training to aerobic activity in adolescence is important, and in adult life. Do what you will do. Do the exercise you will do. Consider morning exercise because the data suggests doing it in the morning, you'll do it more frequently, and do it with friends. So when I talk about an exercise prescription for patients of mine, and there's several here in the audience, we talk about being active with something you'll do. And in Northeast Florida, you got to do it whether it's 100 degrees or raining, and mostly raining. And you got to do it something you enjoy, so then you'll do it. And sure, we all have a joint, a knee, a back, whatever, but you got to do something, you got to find accommodation. Swimming's the best exercise ever invented. You don't have to bear weight, and it is the most calories spent per minute of any exercise that we know of. How about your cholesterol? So really, total cholesterol in the United States, we like it less than 170 milligrams per deciliter. Greater than 200 is really bad. LDL, we like it below 110, and then triglycerides, we like below 150. HDL, we like HDL high. HDL is good cholesterol, so we like that above 35 milligrams per deciliter. But when it comes down to it, most cardiologists think Lipitor should be in the water like your fluoride because those drugs slow down the progression of plaque, and they reduce the incidence of heart attack and stroke. And they're the #1 selling drugs in the world, and so that's why there's an internet full of people telling you not to take them because they want your business. But when it comes down to it, if you have coronary disease or if you have an increased risk for heart attack or stroke or peripheral vascular disease, these are the drugs that are going to keep your pipes open the longest. This is the Ldl Timecourse as we age. In white males in blue, so that goes up with age. In black males in black here, and in white females here, and then in black females here. But what you're looking at is age 8 to age 28, your LDL cholesterol goes up. So there's a time and age-dependent change to our cholesterol pattern. So you may test a bunch of people here, but you need to start testing them all through life and find out who's at risk. And this is the general population. There are people who don't have, for example, a gene that makes an LDL receptor, so it can't take that out of your circulation. So they walk around with LDL levels of 500 or 300. And these people we can pick up early in life now and treat them early in life. This is the effect of systolic blood pressure and diastolic blood pressure on cardiac mortality. It's a complex slide, but what I'll draw your attention to is this bar over here, that if your diastolic blood pressure is low, and then this one over here, if your diastolic blood pressure is high and your systolic is high, the event rate is high. So what this basically means, high blood pressure increases the risk of problems as the systolic blood pressure goes up. So people ask, well, what blood pressure should I pay attention to? The inside of your body wants to live at 120/80. That's where your brain lives the longest, your kidneys live the longest, and your heart lives the longest, 120/80. So if you're not there, you need to get there. We used to think allowing older people to live at 140/90 was fine, that the blood pressure should go up with age because our pipes get hard. That's completely erroneous, and treating people reduces the risk of heart attack and stroke. So blood pressure, systolic and diastolic blood pressure above the 90th percentile for age, sex, and height is abnormal, and you can go to a website and review that. 130/80 is almost always pathological in youth, so above 130/80. New normal, 120/80 or less. The use of proven effective therapy is recommended for adults. The bottom line is, there are 3 things without taking a pill that will lower your blood pressure: avoiding salt intake, exercise, and weight management to an ideal body weight. So if you don't want to take a blood pressure pill, exercise, don't add salt, follow your weight. And these are the things that everybody should be doing anyway. Our diet in the Western world is so overloaded with sodium, so you got to ask for the things low in sodium. Diabetes. Certainly, we want adequate nutrition for pregnant women, but when people are trending toward diabetes at a younger age, their newborns are at risk for diabetes. We want to limit sugar intake, we want to maintain a normal weight for the height, and for type 1 diabetics, we want strict control. But where does our risk for diabetes come? It comes around your midsection, ladies and gentlemen. That's where we carry our risk for diabetes, is around our midsection. And so, knowing your waist circumference and how it fits in your profile for your height and age is important. These are things you can discuss with your primary care physician. But, that's where we gain weight in the Western world, around our midsection, but that's where we increase our risk for diabetes. Other risk factors. Certain Southeastern Asian populations, Aboriginals and Blacks or Hispanics. Let me talk to you about this concept of the Thrifty Genotype. There are parts of the world where for thousands of years, people have actually struggled to survive, but they've survived. Southeast Asia is one of them. For example, there's certain parts of India where there's drought and famine, and people work outside all day long to have a meager existence of the calories they need to survive. That's a genetic population that really has survived against the struggles of both calories and the absence of calories and nutrition, but yet they reproduce. That's a genetic thrifty genotype that exists, but limited calories. If you take that person and you immigrate them to the United States, where there's Twinkies on every corner and tobacco and a sedentary lifestyle, their genes cannot handle it. Their genes came out of a part of the world that were struggling to survive and starve for thousands of years. And you put them in this society, and they smoke and they gain weight, they get premature diabetes, and we see them in the cardiology section of the hospital every day of the week. And we are, of course, the melting pot, so we have to understand that certain people move to this country, adopt a Western lifestyle, and their genes just aren't set up for it. Low socioeconomic level, social isolation, depression, and then gestational diabetes are all well known to be other risk factors. And there's some emerging risk factors, and this I find very interesting. Adverse childhood experiences increase the risk of cardiovascular disease. It's a 1.7 times increased risk for emotional abuse. It's 1.7 times increased risk for crime in a household. It's 1.3 times the usual risk if there's an emotional neglect, substance abuse. But if you add these up, the increased risk goes up. So it's not just that this disease process starts in childhood, but neglected and abused children have a higher risk of this problem. And you know, there's also, everyone that comes to my office, Dr. Crisco, I have heart disease, it's probably because I have a stressful life. My answer is, you have a stressful life, I have a stressful life, welcome to the Western world. The bottom line is this: people who carry emotional stress and don't manage it well don't do the things to reduce their risk for heart attack and stroke. So they don't exercise, they don't eat right, and they smoke, and they don't follow their weight. So it's an indirect but real contributor to risk. So this is the clinical application of the concept of risk. Asymptomatic people, we talk about primary prevention, but when you start adding up all the risk factors, we talk about secondary prevention. It's really, have you had an event or have we documented coronary disease? So we talk about primary prevention and we talk about secondary prevention for those with multiple risk factors or they're unstable patients with cardiovascular disease. And our treatment strategies are more aggressive secondary prevention, more drugs to slow down the problem, more attention paid to the blood pressure, more attention paid to the glucose for diabetics. So the role of the cardiovascular specialist, that's me, education. I'm here educating you. Be an advocate for the heart-healthy public policies. And this is something, of course, that's, you know, public policy change is a real issue right now. But treat individual patients, including their children with significant risk factors. So if you have grandchildren or children, you know, there's no reason we can't start screening people younger for heart disease. And then be an example. If your cardiologist weighs 300 pounds, find a new one. So the global burden of cardiovascular disease is increasing. The burden of risk factors is rising alarmingly in children and youth. Cardiovascular specialists really have an obligation, so educate, advocate, and treat. So this is me in Alaska with my son catching a big salmon about July. I am going to have to run and defer some of the questions to Dr. Pubby, but he's a cardiologist just like me. He knows the answers to all the questions. But I do want to tell you thank you for allowing me to come speak with you today. I very much appreciate it. Basically, this talk was how to avoid seeing me, right? This is like, you know, do all this and you won't need me. So I think I've got job security though. But once again, thank you to WJCT. They do a great job at making resources like this available to the community so we can have a healthier community. And believe me, I'd love to see if you need to be seen, but if you don't need to be seen, then you're probably doing the right thing. So thanks so much.